Yeast infections in the vagina can be brought on by an overgrowth of the fungus Candida. A vaginal yeast infection may change your vaginal discharge and make the region surrounding your vagina burn and itch. What increases my risk of getting a yeast infection? 1. Wearing tight underwear. Yeast infections may be more common in people who wear tight clothing, especially undergarments, or who use fabrics like nylon that retain heat and moisture. Your genital underpants should always remain dry. It's wise to wear cotton underpants. 2. Wearing tight jeans. Tight outfits might irritate the skin and make you sweat, which could encourage yeast growth. Make sure your undergarments, trousers, skirts, etc. are not excessively tight. They can increase your body temperature and create more dampness in your genitals. Your likelihood of getting a yeast infection rises as a result. 3. Douching. The balance of bacteria in your vagina can be upset by feminine hygiene products, such as douches. An acidic atmosphere is maintained by the balance of microbes. The acidic environment guards you against soreness or infections in the vagina. Women's products with strong scents should be avoided. These include pads, tampons, sprays, and bubble baths. 4. Wet clothes. Don't stay with your damp swimming suit or workout clothes after exercises. The remains of swimming pool chemicals left behind by wet costumes fosters yeast infection, especially in the vagina and vulva. Avoid loitering in your wet swimming suit. 5. Wrongly using the bathroom. After using the restroom, wiping from back to front can transport dangerous germs and yeast from the anus to the vaginal region, which can cause a yeast infection. To prevent the transfer of bacteria or yeast between your vagina, urinary system, or anus, wipe from front to back. 6. Not changing tampons and pads regularly. Yeast thrives in wet environments, such as sanitary products such as tampons and pads. Change your tampons, pads, and panty liners frequently when you're on your menstrual period. 7. Uncontrolled diabetes. Yeast consumes sugar. If your diabetes is not properly managed, your blood sugar levels might skyrocket to exceedingly high levels. Yeast may multiply as a result of this spike in sugar, especially in the vaginal region, resulting your body from a yeast infection. 8. Taking hormonal birth control pills. By disturbing the body's normal hormonal balance, these hormones might promote yeast growth. The estrogen contained in birth control pills is considered to increase the amount of sugar produced by the vagina. These sugars stimulate the yeast that is already present in the vagina to flourish. 9. Pregnancy. Since hormonal fluctuations may affect the pH level of the vagina, yeast infections become more frequent during pregnancy. Itchiness in the vagina and a thick, white fluid that resembles cottage cheese are typical signs of a yeast infection. Women who have weaker immune systems are prone to developing a yeast infection since their bodies are less able to battle the yeast. Consult your healthcare provider immediately if a yeast infection has appeared for the initial time. Despite using non-prescription medications or vaginal lotions with antifungal ingredients, your symptoms persist. Despite your best attempts to observe preventative measures, you persist to have yeast infections. See you in our next video for more educational tips. Please subscribe, like and give a thumbs up to our daily posts and videos. Thank you.